Welcome to the Global International Pedagogical Forum, IPF 2020, which I'm representing now. My name is Lilith. And today, my guest is Professor Vincenzo Cerullo, Professor of Biological Drug Development at University of Helsinki, Head of Drug Research Program Helsinki, and Scientific Founder at Valo Therapeutics. Honorable Professor, we do appreciate that you took time to participate to our forum and answer our questions.
Thank you very much for your kind invitation. I am very happy and honored to be part of it. Hopefully, I will have answer to all your questions. Although, as I said several times, it's very difficult time to have all the answer you are looking for. But hopefully, I will be useful, and this informal chat will be useful for everybody. So once again, thank you very much for the kind invitation of the International Pedagogical Forum. Thank you for everybody that is listening and will listen to this small and humble chat.
Thank you so much. I'm sure that we will find all the answers to the questions. So, though the coronavirus infection has hit all the countries all over the world, there are still many rumors about it. So the very first question is whether COVID-19 is really exist.
That is a very easy question to answer, and the answer is absolutely yes. It does exist. It's a real virus, and there is no doubt about it. So that's very easy question to answer, and yes, it's a big yes.
Okay. And is COVID-19 is just an ordinary flu, or this is more serious one? I mean, many scientists talk about the scientific nature of COVID-19, that it was developed in the laboratory. What do you think about that?
I think that's. I think this is not true. This is a virus that spilled over, emerged. I mean, there are about 7 different coronaviruses that have passed from different species to human. This phenomenon is called spillover or zoonosis. 4 of these coronaviruses are very mild in humans. They give us a little bit of flu symptoms, but not more than that. 3 of them are a little bit more dangerous, and one is SARS, the second one is MERS, and the third one is SARS-2, which is basically the virus that we are dealing with at the moment. So the virus, they do exist, and this is a real disease. Actually, the name of the virus is SARS-CoV-2, SARS coronavirus 2, and the disease that the viruses cause, it's called COVID-19. A little bit like, if you want, for the HIV and the AIDS. The HIV is the name of the virus, and the AIDS is the name of the disease that the virus is causing. So the name of the virus here is, again, SARS-CoV-2, and the name of the disease is COVID-19.
How to deal with the virus COVID-19, and what to do with the pandemic?
Well, how to deal? It's a $1 million question. I mean, that's been, as everybody know, quite difficult to deal with a pandemic that somehow goes out of proportion. There are at the moment a lot of clinical trial to try to find possible drug to treat the disease, and at the same time to develop vaccine to prevent the disease. So with every infectious disease, we need to understand that there are 2 different ways of treating. They are both extremely important. One big avenue is finding drugs to treat the disease. So this is for people that have already gotten the virus and they are already basically sick. In that sense, there are a lot of clinical trials at the moment. I'll give you a nice exercise to do later on, where basically people are on one side developing new drugs, but that would take a little bit of time. What is even better, there are a lot of scientists that are repurposing already existing drug. So drugs that were developed for different viral infection or for different disease are now being tested for whether or not they work to treat the COVID-19 disease. And that's one big basket where we should look into and put a lot of hope, because for sure some very good drug, and there are already very nice drug. If you think in these months, the way we are treating, the way our physicians are treating the disease has already been improved a lot, because they are getting better, they know how to deal with, but also because of these drugs. And that's one big basket. And then there is the second basket. And the second basket is the vaccine. So simultaneously to all this drug repurposing, there is also this vaccine development. Now, the vaccine development takes a little bit longer time because it's about develop new thing that did not exist before. Unfortunately, during the SARS epidemic, there were programs starting to develop the SARS vaccine, which they might have worked for the SARS-2 infection. But unfortunately, when that epidemic back in 2003 finished, this program were interrupted because the founder of this scientific program, they thought, well, they're not useful anymore. But nowadays, probably they would have been important. So this is again also important for us to understand how the importance of science in 360 degrees, even when something we think it's over, well, this infection is over, we should stop the program. I mean, science is really the fundament of our society, and scientific advancement is the fundament of our society. And we should never think that scientific program should be stopped. To summarize my question, otherwise I'll talk for 2 hours, you should know that I like to talk, drug development is ongoing, and there are a lot of drugs that are showing good results in phase 1 and 2 clinical trial. And simultaneously, there are a lot of vaccines that are also being tested. I can tell you that I've given a lecture on vaccine development for COVID-19 about 3 or 4 times during the last 2 months. And I've seen, and it's very funny to see how my slide have evolved. First time I gave the lecture, there were 4 ongoing clinical trial. 2 of them were vaccine. The last lecture I gave, there were about 900 different clinical trials, and about 70 were vaccine. And I'm pretty sure that if you will look today, there will be even more clinical trial and even more vaccine development. This is just to give everybody hope that I think science has never been so timely, has never been so prompt to reply to answer to this need. And there is a lot of vaccine in development that I'm pretty sure from in about 1 year or so, or probably 8 months, 1 year, we will have a very nice working vaccine.
Anyway, at this moment, the pandemic is widely spreading, and the scale of the pandemic is very high. What can you tell about the indicator of infected doctors and nurses about this process?
Yes. So one thing that I've noticed, well, first of all, it's true. What was an epidemic has transformed in a pandemic, basically spreading in several continents and spread basically everywhere. At the very beginning, the treating physicians were also, as usual, unprepared. So whenever a new infectious disease is hitting, at the very beginning, it leaves always everybody like under shock. So all the measures that then become implemented at the beginning are not in place yet. And that, of course, results in more people getting sick, and especially doctors and nurses getting sick. Because, of course, everybody that is sick is going to the hospitals, but the hospital, they don't know yet, they don't have implemented yet all the measure and the structure that is needed to contain the infection. And this is, what has happened also at the very beginning, for instance, in Italy and also in Wuhan, what has happened with the SARS, back in the days, that people were just unprepared. But I like to also to say how reactive these places were, because then after the first initial shock, then all the hospital have started taking the correct measure to contain the pandemic, so that people with symptoms were entering different doors from people than other symptoms. They were entire department that were completely turned into COVID department, and that has in a way lowered the amount of important personnel to be sick. That's one thing, and it's the good thing, the good news. But of course, there is also the bad news that is also made, that regardless of all these cautions that has been taken to avoid the important personnel to be sick, regardless of that, these nurse and doctors, they are continuously exposed to such a high viral dose that, of course, when they get sick, if they get sick, they get sick with much more viral particle. And this is not shown, it's only my personal opinion, but I have the feeling that, of course, when they get the infection, they do get infected with a very high viral load. So in a way, the immune system is struggling more to fight the infection compared to a person that gets infected in a supermarket eventually because somebody has sneezed or something. That kind of infection is an infection that expose you to, in a way, to lower amount of virus compared to a person that is treating this patient every day. But again, this is just my personal opinion. I'm not even sure it's true. But what I wanted to say that what we have seen at the beginning, it has been in a way changed once we know better with what are we dealing with at the moment.
Okay. Going back to China, where it was started, China turned out to be more faster, more efficient in the fight against the coronavirus. Wuhan is open now, and many countries all over the world are in a very difficult situation at this moment. What was the reason of it? China uses a disease monitoring system based on example of SARS. Is there such monitoring systems in other countries as well?
Well, I don't know the situation of every country. I don't know what kind of monitoring system they have used and how different is their monitoring system compared to other countries. Although it's clear that this has been implemented also somewhere. But one thing, and that's very difficult to know, but at least two things we can say for sure. The first one, that the most effective treatment for this pandemic so far has been the lockdown. That's no doubt. I mean, of course, there is science is advancing very, very rapidly. And as I said before, scientists have really responded with energy to this, and I'm super happy and proud of this. But nevertheless, under the shock of a pandemic, uh, one thing that has worked for sure has been the lockdown. And that's no doubt that the more, how do you say, the more severe or the more the, well, the more severe the lockdown was, the better the infectivity was going down. That doesn't mean that I'm not trying to say that that is the solution, because we know that lockdown has consequences that go behind the science. So I'm only talking from the scientific point of view, and from the infectivity point of view. The only way to stop disease, for what we knew 1 month ago and what we know now is not getting in contact with others. So I'm a big fan of the lockdown for the time being. You know, we are developing drug, great. We are developing vaccine, great. Meanwhile, let's try to fight the virus by avoiding the virus to spread. That's one of the reasons why probably in China has been in a way has recovered faster than somewhere else, because of course there probably for political reason, for cultural reason, the lockdown has been more strict, and people were somehow more following the rule than somewhere else. That can be one probably simplistic explanation, but that's definitely an explanation if we consider real data that have demonstrated clearly on scientific papers that lockdown is at the moment the most effective treatment to avoid the spreading of the virus.
On January 7, 2020, a virologist from the Wuhan University warned of a coronavirus pandemic and released into the world a fully defined pathogen genome so that everyone could as quickly as possible develop kits for researching the issue around the world. Has anyone dealt with it?
Yeah, of course. I mean, that was the key. I mean, we couldn't have done anything without the sequence of the virus. So, in my opinion, that has been, a milestone in this story, when the virus was isolated and the sequence of the virus was basically made public. Then after that, vaccine have been developed, and kits for diagnosis have been developed, and so on and so forth. So the scientific story of this pandemic starts when the virus has been isolated and the genome has been shared. That's basically it. So it's been a milestone there. I think the very first vaccine, which is an mRNA vaccine that has been developed, was developed in consequence of the release of the genome in a record time of a couple of months, but only thanks to the genome. We couldn't do anything without the genome of the virus.
What do we know about COVID-19 at this moment? We know that average incubation period is 5 days. We know risk groups, men and women over the age of 60. We know that asymptomatic carriers can infect other people. We know that vaccination against coronavirus infection have never been developed so far. What else can be added to this list? And correct me if I'm mistaken.
Now, first of all, you are not mistaken, and second of all, I think that's all we know. This is a joke, but there is one thing that I've learned during this past month, has been that scientists. Oh, no, this is well. wrongly put. What I wanted to say is that science in general deal with the fact that we don't know, and scientists are triggered by fact that we don't know. When we know something, then it's not science material anymore. It's probably, book material. So my feeling is that we know something about this virus. What you said, we know pretty much the incubation time. We know pretty much that can be, can mutate, but probably not too much. We know, for instance, something that I'm not sure you have mentioned, that we can somehow develop antibodies against this virus. That's pretty much it, what we know. But there are a lot of things that we don't know, and I think this is what makes this very interesting for scientists and for science. Now, when scientists talk to each other, they always say, "Well, we know. Well, we have demonstrated this and we have demonstrated that," but it's a scientist slang. Because when scientists talk to other scientists and they say, "We know this," that means we know that so far, but that things can change tomorrow. One thing that I've noticed during the pandemic, where a lot of very good scientists have been interviewed, is that we have not taken, or non-scientists and journalists have not taken into account the different language. That when we say we know, it means something else. It means that today we know, tomorrow we'll see. But on the other hand, non-scientists, they take this information for Bible. And that has created a lot of misunderstanding, a lot of misconceptions on what it's really known and what is known at the moment that will change tomorrow. So to answer your question, the first answer I will give to you is that we know very, very, very little about this thing. We are trying to understand as much as possible, but we know also very little. There are, tons of inexplicable fact that we deal every day. Why this person, why the serological analysis in this country was so low, and why that. There are a lot of why that we still need to find out. So your question in brief is, there is a lot to know and there is very little we know at the moment. But you said pretty much everything we know. We know that this virus exists. We know that gives this disease. We know that this disease affects women more than men. We know that this disease affects old people more than young people. We know that this disease affects also children somehow, or anyway, children can have the virus. They don't develop symptoms, but they can be infected with this virus. This was recently also published in a very important scientific journal. We know that somehow some of us, and we don't know if some of us or all of us, but some people develop an antibody response against the virus. We don't know if everybody develops the antibody response or some people develops the antibody response. That we don't know. And this is, I'm talking now about the obvious, because we should know these things. I mean, those are easy questions that we should know, but somehow we don't know it yet. And we shouldn't be afraid to say we don't know, because those are so key questions to answer. And that's okay that we don't know, because I was talking to a friend of mine this morning, and he was asking pretty much the same question. And I said, try to get a very big jar of water and try to put into a graduated cylinder. And then me asking you, while I'm pouring the water, sorry, how much water is it? Is it 1 liter or 1 liter 25 or 2 liters or 1.5 liter? But during the water, during the time the water is falling down, you have no idea, and you can guess, but it's only a guess. What you need to wait to answer this fundamental question is all the water to go down, and then the water has to calm. And then when the water is flat and the cylinder is on a flat surface, then you can measure and see, well, that was 2 liters, 0.25 or something. But during this, there are suggestions, there are speculation, there are very important studies that are released every day. And I read a lot of nice paper every day. But, case studies of 14 people, 17 people, 12 people, they are super important from the scientific point of view, but do they give us the real answer? That's the question. And in my opinion, not yet, because water is still falling down. So we have indication, but we don't have, certainty or to say like, it's like this. So, for instance, back to the antibodies, we know that some of us develop antibodies. How long time do these antibodies will last? It's 1 year, 2 years, 3 years. We can predict with mathematical model that probably if they are similar to other coronavirus, they will last this time frame. But can we bet our money on it? I wouldn't. I mean, there are a lot of things we unfortunately need to sit and wait, be very careful, follow the science, follow the rigorous science, not put too much pressure on scientists and give them the time to be rigorous, to be, to really come up with data that are reliable, and then we will have the answer. Sorry, I've spoken too much, but but as I told you at the beginning, I like to talk, so you should stop me at some point.
So speaking scientist language, why is COVID-19 dangerous?
Well, one of the first thing that comes into my mind is, and that's it's dangerous because it goes into part of our body, which are the lungs. So, well, every virus, we are exposed to millions of viruses, and not all of them kill us. Some usually a very successful virus are viruses that don't kill their host, because it makes no sense for a virus. I mean, a virus cannot live without a human being, so they need to make sure that we don't die. The dangerous part of corona is the fact that they go in the lung, and that makes the corona so much different from other viruses that infects pretty much the same part of the body. Influenza, for instance. I mean, corona has been compared to influenza a lot of times. They are completely different viruses, and they do different things. But a big difference there is that influenza goes in the bronch and gives you a bronchitis, which is a completely different thing that pneumonia. So the location where the virus go, it's more difficult to treat and to be treated. And that's one thing that makes the virus more dangerous, if you want. Another things also that, at least to me, although we don't have super indication, but I think this is clear to everybody, is the incubation time. When the incubation time is long, it's very difficult to isolate the sick people. Now, if you compare SARS with SARS-2, those two viruses are quite similar. But the biggest difference between the disease, SARS and SARS-2, is the incubation time. I mean, people affected with SARS, they were sick pretty much soonish, in 1 or 2 days. You knew that person was sick. So it is easy to isolate people when they show symptoms. And in a couple of weeks, you can actually lock in everybody that is sick. And that's how SARS was, in a way, fought, and we won the fight. SARS-2 became a little bit more intelligent, if you want, from the virus point of view, because the incubation time became longer, and even worse, there are a lot of people with very mild symptoms that can spread the virus, and even worse, there are people that have completely no symptoms that can spread the virus. Now, from the virus point of view, this is a lottery, because if I don't get people sick, people cannot isolate me as a virus. So it allows the virus to spread very, very easily. And that's the reason why the lockdown has been the only so far, or the best so far, way to treat the virus. Because we don't know who is sick and who is not, sorry, we don't know who has the virus and who has not the virus. Because there are people that are completely symptomless and they do have the virus and they are able to spread it. So, in my opinion, if I had to bet, or if I had to answer to your question, uh, and I had to, I will say, the most tricky part of this virus has been the fact that most of the time gives mild, if not a mild symptom, if at all, symptoms, and that has allowed it to spread a lot without basically finding the weak link, and then of course get people sick.
You mentioned that antibodies developed, and what at this moment, what do we know about the immunity? Is it true that people who have had a coronavirus infection cannot get sick again, and how at this moment, how long time this immunity can protect us?
Yes. Uh, as I said before, this is an easy question to answer, because the easy answer is we don't know this question yet. And that's basically the big answer. Now, below this answer, we can speculate, because there have been a lot of, not a lot, but several very good papers showing that indeed people recovered with actually people that have been exposed to the virus either recovered or even dead. There was a very nice paper even this morning published on 19 cases of people that died of COVID-19, and it's clear that they have developed high titer of antibodies. So the majority of them, I think they were 14 out of 19. So the majority of people, either they are recovered or not, they do develop antibody response. This is what we know at the moment, based on studies that anyway are based on very small cohort of people that have had the disease, and they've gone to the hospital with the disease. Now, those studies are not really based on people that were symptomless or people that had very, very mild symptoms, because we don't know who are these people. I mean, I might have had the virus and I don't know. And I might have or not have the antibodies and I don't know. And we will never know. So again, there are studies, and those studies are very good studies by very good group, and published on very good journals, including The Lancet and Nature Medicine, and Immunity just this morning. But in particular, two studies published this morning, one on immunity and one on Nature Medicine. The cohort were very small, 19 patients on one side and about 14 on another side. The majority of these people had developed antibodies. So we could think that, yes, there is an antibody. How long time do these, well, first of all, do these antibodies protect them from being re-exposed to the virus? We don't know. My bet, yes, they do protect them. If they are good neutralizing antibodies, they should protect them, because I don't think the virus can mutate the well, let's call it external part of the virus so rapidly to skip the neutralizing antibody. But uh, uh, how long time do they last? Well, we have no idea. We can speculate and say, well, probably 1 or 2 years, because this was what we have seen also with other coronaviruses, probably, but nobody can at this stage give fact on those, because we should wait 2 years to know. So you know, uh, we know we do develop antibodies, or at least people that have gotten symptoms, they do develop antibodies. Um, we don't know if those are neutralizing antibodies, probably yes. And we don't know how long time those antibodies will protect these people.
Okay. And what about summer temperatures? I mean, will summer temperature help us to stop the flow, or
I'm so
it's
sorry,
just
but here
rumors?
I really have to say nobody knows. Uh, uh, I mean, it's I mean, well, short answer is we don't know. The long answer is let's chit chat together and speculate about it. I mean, in Finland, we have had less cases than in Italy, although here it's still 5, 6 degrees. And in Italy, were already, 2 months ago, 20 degrees. I mean, I have very, very, very hard time to think that the temperature has the external temperature. I mean, the temperature of the weather temperature will have has any effect on this. But again, I mean, I'm not really at this. I'm not really an expert in this, so I might miss some very important knowledge that will allow me to connect the dots in this specific area. Uh, but again, we have seen the virus spread all over the world in a completely temperature unrelated um, countries. I mean, again, a good case is Finland. Finland has had a lot of contact with Asia anyway, so probably we were exposed to the virus, and it's quite a cold country. Again, it's still 5, 6 degrees outside, and yet we have less cases than very warm countries. So I don't know. I mean, it's to me it's very difficult to even speculate about the relation between the temperature or the weather and the virus. Eventually there is, but I'm not really the right person to speculate on this. I mean, you would require people that are really researching in this specific field.
Okay. And what is the current situation with COVID-19 in Finland now?
It's quite okay. I mean, we have had a very good lockdown. I mean, and in my opinion, very timely and also very nice lockdown by the Finnish government, and also by a lot of private company, including the Finnair, that completely stopped, flying to countries during, that were more at risk. I was, as non-Finnish citizen, I was very impressed by these actions. The lockdown has been, I would call it light lockdown, not very severe, like for instance I've seen in Italy, but it worked very well for the Finns, because in general, Finns are already very well educated to not shake the hand. Social distancing here, it's a concept that everybody grows with. I mean, you don't need to teach Finns what social distancing means. I mean, they are born with it. Sometimes I have joked with my Finnish friend that when they heard that, you should keep 2 meter distance, they freaked out, because why we should be so close nowadays? Because we are used to be more distance than 2 meter. This is a joke, but tells you a little bit about the culture. So in that sense, has worked very well. So the situation at the moment, I would say, is under control. In fact, yesterday we have reopened the school. I mean, my children went to school again yesterday for the first time after March 9 or so. So after the first or second week of March, they were very happy. We are thinking to reopen restaurant and all this other business. So in that sense, situation is totally under control at the moment.
Great.
But again, we are
So,
now reopening the school and reopening the business. So we should talk again in 2-3 weeks from now and see how these two things will affect the infection.
in a way, you mentioned several times that lockdown, that quarantine that many states impose are the most effective measure against the fight against the COVID-19. And what other measures should be taken not to get sick or to
Uh,
suffer?
I think I think that, as I said before, I've been once I heard something that I mean, virus cannot really walk. So the only way that prevent you to get sick is not to be in contact with sick people, and that's basically the only scientific proven methods to avoid getting the disease. I mean, all the rest, it's actually nothing. So I think lockdown has been, as I said before, the real preventive. I mean, the most effective preventive measure that countries have taken, and that's it. Then there is nothing else you can do. Of course, people have said, well, you should be healthy, and you should live a healthy life, and you should eat good, and you should avoid to smoke and all these things. It is obvious, all those things, but they don't relate to COVID-19 only. They relate to every disease you can think of. If you live a healthier life, if your immune system is better, if you eat better food, and if you are a healthier person, if you don't smoke, and if you don't drink too much and things like that, uh, then obviously your body is stronger to fight diseases in general. But that has nothing to see with COVID-19. I mean, when it comes to COVID-19 specific, then just don't be in contact with people that might be sick, and be social responsible. If you think you're sick, just don't go in public places and lock yourself in. As simple as that.
And what about the treatment of COVID-19? And the more important question, I think, when will the vaccine appear?
Treatment, as I said, there are a lot of very interesting drugs that have been repositioned to treat COVID-19. Some of them, they seemed very promising at the beginning, but then now it looks like they are the interest and the efficacy is fading down a little bit. But again, we will see after all the phase 1, phase 2, or all the clinical, when the clinical trial will be really finished. There are a couple of antiviral drugs that instead are given good results, which is quite nice and promising. But again, and of course, in addition to this drug, as we discussed already at the beginning, there is also a growing understanding of the treating physician on how to treat this patient, when to treat this patient. In addition to that, the vaccine. As I said before, there are at the moment several tens of vaccine uh, under development. Some of them in a very advanced phase, which means already in human. This is a very good news. But one thing that also we should understand when we speak about vaccine, that there is a difference between when do we have a vaccine in human and when do we have a vaccine that we know it works in human. Because when you now vaccine are a little bit peculiar drug compared to a lot of other drugs, because vaccine is given to people that are not sick, right? If you think 90% of, or no, I would say 100% of the drugs are given to sick people. So in a way, it's easy to measure if the drug are A, non-toxic, so they don't harm, B, if the drug is working. I mean, if I have a temperature or if I have a headache, I take a drug and you just measure whether or not, my temperature is going down or my headache is over. It's easy to measure. But vaccines are peculiar because vaccines are given to people that are not sick. So how do we know that a vaccine is working? Usually you take two groups of people, and one group of people is given the vaccine and another group of people is given something else than a vaccine. They don't know what they are getting. So it's a double blind. And they are sent out. And then you sit and wait for these people to be sick. But the point is that you sit and wait. So here the key word is wait, because I need to wait enough time for those people eventually to be exposed to the virus, eventually to get sick, and then after a certain amount of time, let's say a couple of months or 1 year or whatever, I call them back and then I check how many people got sick in my vaccine treated group versus how many people got sick in my control group. Now everybody can understand that this is a matter of time, because if I call you back after 2 days, my vaccine doesn't work because all the people in my control group are not sick. If I call you in, the more time I wait, the more are the chance that I can see whether or not my vaccine is working, because it's all based on the fact that the control group is getting sick. So it's easy to understand that there are no shortcuts here. You should sit and wait for these people to say later on, yes, this worked. Now, we hear in the news very often, which is super good news, but we hear very often, well, this company has just started their clinical trial. Well, does that work? We will never know, and the only way to know is to wait. So I'm very happy that a lot of vaccine, at least 60 different vaccines, are developed towards the clinical trial, which is super good. It means that they will be tested in human, and the majority of those are already being tested in human, or probably not the majority, but a good part of those is already being tested in human. But that doesn't mean that in 1 month or in 2 weeks, we will know if they work. We can hope they work, but it's not necessarily said that we will know they work.
Okay. Honorable Professor, thank you so much for the interesting interview and for your valuable opinion. Stay healthy and safe. Thank
Thank you
you.
very much. Thanks a lot for having me. Bye, and have a nice day, everybody.
Thank you. Thank you, as well.